Thank you for coming. So today we're going to be talking about trauma and impact of trauma in children and adolescents. It's a bit of a sensitive topic, but we're going to try to break it down into understanding more about it. We're going to walk through what is normal brain development, some statistics, types of traumas that we can experience, the impact, emotional, behavioral, and how can we intervene, support, and prevent trauma. So it's very interesting that during the first 6 years of life, actually 90% of our brain develops. So we're born with less than that, and by age 6, we've reached our brains keep pruning and developing, and more connections start forming, and then by age 6, 90% were there. And only 10% gets formed as we grow older. So the first 6 years are sort of a really essential part of our development. Early life experiences are like blocks. The more organized we are, the better they are, the more messy they are, the messier the connections later on. And as we grow older, more connections start building up. And this is just a graph. I know it's a lot of numbers, but it's basically the same idea about how first 6 years of life are the most important ones. So our sensory path, or how we hear, touch, smell, are mostly during the beginning. That's why babies, when they're in their infancy, they're soothed by cuddling, they like rocking, because these are the main sensory inputs that they have in the beginning. And then starts language, and it starts developing then. We think that we start talking, maybe you can have a seat here. So language, it says here that we start forming, so usually developmentally we should start babbling in the first few months. By 6, we start saying our first words, 2 to 3 words by age 1-year-old, up to 18 and months of age. And then by age 2, we start forming sentences like, I want milk, or I want to go here or there. But most of our language development happens during our early childhood. And you can see that spike, how it grows up really fast during the first few months or first few years of life. And then no matter how languages we learn, that spike of learning goes a bit slower, and it's harder to learn new languages. That's why when we have multilingual parents, they always recommend that they speak with each parent would speak with the language separate from the other, because most of the language learning happens in the beginning. And then there is higher cognitive function, and which is where we start learning how to problem solve, how to fix things, how to have scientific topics, comprehension, and it all starts developing during early childhood. Why am I talking about this? Because basically these are all experiences, whether it was sensory, how we hear, feel, smell, see, whether it was language that we hear, whether it was knowledge that we're learning, they're all sensory experiences. And as we grow more experiences, this is how our brain develops. And this is a guy called Abraham Maslow. He developed Baraa here, he's nodding. He's developed this hierarchy of needs. And the main idea is that as our needs are met at the base, this is how we can progress to let's see, this is, yes, no way. Okay, so the base is our physiological needs. So our food, our sleep, breathing, all of our homeostatic functions in the body, this is our basic need. If those are met, we can progress to having safe environments, we can feel sense of family, a sense of property, health. And if we don't have that food, water, sleep, basic needs met, we can't really experience that sense of safety as we grow up. And if we don't have that sense of safety, which is the basic and most important part of our discussion, we can't have that sense of love and belonging to each other, forming relationships. This is more adults-oriented and Western-oriented. And then as that, we form better relationships with others, having connections, family, friends, wife, husband, then we can develop more esteem. It doesn't have to be someone who's married, but basically the ability to have those relationships and maintain them can help us have a better self-esteem. And then the top of the hierarchy is self-actualization, which is when we have a sense of morality, ethical values, we have the ability to problem solve, we have the ability to accept others, we don't have that prejudice and judgment of others. And if we don't have that base, we can't get there. So the main idea from this, and this is a theory that has been applied also in parenting. So when someone comes in and has difficulties forming friendship at school, we go back to safety, a step down. Is he having a safe environment? Any aggression at home? Any violence? Any domestic violence of any sort? Any verbal violence? Any form of abuse? If it's not there, are we actually having our basic needs met? Is he sleeping properly? The basic stuff. We go back to sleep. If he's not sleeping well, he's going to be grumpy in the morning. He's going to be more aggressive. He's not going to have an ability to form relationships, and he's going to fight with other kids at school. So we always have to go back to the basics. And here the most important bit for our topic is safety. And if we don't have that sense of safety and security, whether it's at home, in the family, at school, in our community, we can't progress to having that relationships, sense of self-esteem and confidence, and eventually having that personality that's well-rounded. So trauma and stress. I want to discuss this topic, which is this expression allostasis. Has anyone ever heard of allostasis or homeostasis? So homeostasis is more about having that balance, and allostasis is about having that balance in face of challenges or change in energy. So just like a seesaw, if we're standing in the middle, we're maintaining our balance. But if we have some stressors on that end, the other end of the seesaw, we can have difficulty adapting to that. So allostasis is how we adapt in face of that energy that's opposing us, that's causing that pressure on the other side. If it's too much stressor and we're lightweight or we're not heavy enough to handle it, then we can fall off. And this is where trauma happens. So trauma is basically us having that increased intense stress that is beyond our capacity to cope and makes us lose balance. So what is trauma? Any thoughts from your personal experience, if someone in their clinical practice? We've had discussions before our talk about trauma and our personal experiences. Go ahead.
I think trauma is something happened like when you was not young and it affect your future in some like stress or like anxiety.
Yeah.
I think trauma you cannot like know what is it exactly until you go with a specialist so he can tell you what happened exactly in the past and the future.
Yeah.
I think this is
Yes. So you mentioned something significant, which is a major event. Yeah. Oh, that's sure. Okay.
hello. أنا مرحبا.
So we're asking what trauma
Yes,
is.
trauma, I think that it's something happened in the past and can affect your future, but it's something like, I feel it's like a mystery. You cannot know exactly what is it until you dig in your past.
Yeah.
And it's something happened, I think, in the early stage, as you mentioned, and it causes like a stress, like anxiety, sometimes depression. This is like, I don't know what's exactly trauma, but I feel this is like
It's very close. So it is something major that can happen to us. And it has a lot of impacts. Anxiety and depression are one of the ones you've mentioned. And Dr. Ziad, you wanted?
I think trauma is any disruption or violation to the structure of any organism or any structure as a whole.
Yeah, that's a typical medical answer. A fracture. Dr. Ziad is a general surgeon. So it's very, us coming from the medical field, we think trauma, we think fracture. And it is that imbalance and that disruption in the organization, just like you mentioned. But trauma does not have to be that immediate and that big. It can come in many forms. It can be that major event happening. It can be during childhood, it can be during adulthood. Anytime it can happen. Trauma can happen to anyone, but it also causes that major impact. Trauma, even fractures in medical field, they do not have to happen just suddenly with major impact. It can happen after repeated also impacts. So for example, if our bone is weak or we're having osteoporosis or any chronic medical condition like cancer that has weakened our bone and we have that persistent pressure on it, then we get a fracture as well. So yeah, sure.
Does trauma happen the long-term effects of it are in childhood which continue into adult age, or it can happen in your late teens as well?
And continue to adulthood. So trauma can happen anytime. This is part of us living in an unpredictable environment. A lot of predators as we live in early ages. And as we grew and as humans evolved, we've had a lot of different stressors. Now, stressors and trauma can be major financial loss. You're in the finance. And it can be something like death of a loved one. While maybe previously it might not have been major impact on a tribe, right now it can have major impact, especially if it means a lot to you. So it's not just the event, it's also the experience. And this is where we want to think. So it can be a major traumatic event in childhood, but it also how we perceive it as an experience. So a same event can happen to two different people and they experience it differently, and someone gets traumatized and the other one doesn't. And if anyone has any question, please just go ahead.
Let's say I'm giving you a fictional example.
Okay.
Let's say you are involved in a group car accident,
Okay.
because of which you now, let's say you were not driving, but you witnessed that accident or you were involved in that accident. So you developed, in a way, fear of driving,
Yes.
either on that road or in a group. So how do you go about in terms of firstly understanding that you are in that trauma and then seeking help or medication?
Yeah, so this is definitely a traumatic event, motor vehicle accident. It can be someone who's driving, it can be a child at the back seat, it can be someone who passed away in the accident while I didn't. So it is a major traumatic event. We're going to talk about the interventions later on, but it's a good question. So our main, let's say, resource that we resort to is the Diagnostic Statistical Manual, or DSM-5. It's what makes us find the diagnosis of any, we have a specific criteria for any diagnosis. And for trauma, for us to say that someone has been exposed to trauma, according to this manual, it has to be a very major life-threatening event that either was directly experienced or witnessed in person. So for example, in cases of a bystander that witnessed a major car crash, or it can be learning about the traumatic event. So it doesn't have to be us experiencing it. It can be something that happened to someone else and we came to know about it. Just like someone who died in a car accident or a very major or horrific car accident. Or it can be experiencing repeated trauma. And it can be, and this is an example that that happens with emergency physicians that can get exposed to a lot of traumatic events, patients with polytraumas, and they see this repeatedly. They get sort of accustomed to it, but it can suddenly start that pile up and impact suddenly shows with a major traumatic influence on them. In numbers, trauma is something really common. CDC says that adverse childhood experiences like abuse or neglect can happen in 1 in 4 children. That's a quarter of all kids. That's like if we are 20 in a room, at least 5 of us have experienced abuse or neglect during our childhood. But this is, again, CDC, and that's US statistics. And it estimates that trauma as a major significant event that's life-threatening happening to us or to someone we love can happen from 30 to 70% of people. So it's really, really common. But when does it cause that major distress, that major impact on us, and when it doesn't? different traumatic experiences. One of them is neglect, and I started with that. So trauma, usually we can easily relate with abuse and trauma because there is like a major harm caused. But what do you think of neglect and trauma? Can neglect cause trauma? إهمال. Yeah, so neglect can be us not providing food for the kids. Yeah, yeah. Can you elaborate?
Being not seen from others or by parents or friends or anything would make you really feel that you are outside.
Yeah. Yeah, being left out and how that is perceived by me. So it can be perceived by me as because I'm so special, they can't keep up with me, and that's not going to be such a traumatic event. But it can be like I'm not wanted, I'm not loved, no one cares about me, and I don't have that stable relationship with a parent to buffer it, and then that's a major traumatic event. Abuse in all its forms, accidents, natural disasters, wars, traumatic separation. For example, during migration, immigration, incarceration, if someone was jailed or present, whether it was a mom or a dad, it can be a major traumatic event. Sudden or violent loss of a loved one, violence in the community overall. So I'm not going to elaborate a lot on that, but traumatic experiences can happen in anything, really. It can be at a workplace, at home with family violence. It can be in nature with the sudden disaster like Katrina and hurricanes, earthquakes. It can be war like we're witnessing in the world. It can be abuse in all its forms, whether physical, sexual, emotional, and neglect. I really like talking about neglect because people don't think that they usually associate trauma with us doing something like hitting or slapping or yes, bullying, doing something. But neglect, which is not doing something, is also a really major traumatic event. It's especially in the first 6 years of life, when that's 90% of our brain is being developed and all those synapses and connections between our neurons are forming up. It can involve sensory deprivation, which means that I'm not being played with. So a child going to his mama with asking for her attention, it's actually a need that they have. And when we deprive them from that need, that is a form of neglect. Not if we are just busy, like working moms, and they have that, but if we're persistently depriving them of that need. For example, the need for feeding and then being dismissed, staying hungry for a long time, being deprived of touch. Some moms with certain conditions, for example, postpartum depression, does not want to hold her baby. And that is a form of neglect and can influence our brain. And this was really shocking for me to see when I was researching the topic for the presentation. These are, one of them is larger than the other, but it's just magnified. So the left one is a normal brain being developed, and the right one was another child that has been impacted by extreme neglect. So we can say that it's not just emotional or depression or anxiety, it's actually gross changes to our brain that can develop. So the more we are touching, hugging, talking, playing, the more their brain's developing. And that's only during the first 3 years of life. And if we're not providing that, that's less brain, basically, less connections, less development. And that's horrible. This is traumatic. Yes. Yeah. And thinking about neglect, and I really need to say that being a working mom, we always have that sense of guilt that we're not paying them a lot of attention or not giving them that enough care, or that's a different form of neglect. Neglect is more intense, more persevere, and they're completely deprived of their basic needs. So, for example, and I know this one is a bit sensitive, but for us watching the mobile phone while the kids are around us, if it happens momentarily, that's fine. But when the kids are always around us and I'm always on my phone, that's me depriving them from eye contact, which is something that they really need to develop their brains. So that form of persistency and a pattern of a relationship between the mom and a child, or the dad or the child, it doesn't have to be with the mom. It has to be just at least one main caregiver that's providing that sort of connection, whether it was with eye contact, interaction, play, talk, cuddling, shared activities, a lot of things that we can do. And it can be just 15 minutes a day. So I always tell parents, almost a remedy to avoid that is just 15 minutes of quality time. So if we have that 15 minutes with a child where we are fully devoted, giving him direct attention without mobile phones, nor Apple Watch. Yes, quality time. So that's just special time for the child, knowing that this is his or her quality time, with complete attention, his choice of activity to do, and following their lead. That can be enough to remedify that. So how do children react to trauma? It depends. Every child reacts differently. But what do you think makes it different? Because we had that discussion early on that, for example, someone having 3 kids, one child seems to be more influenced and more sensitive to any event happening to us in our life, while the others are fine. The same event happening to 3 kids, and one of them is reacting in a different way than the other. What do you think makes a difference? Or why is it different between one child to another?
Can be different from one child to another, or simply a person to another in general, because every person copes differently with things that they're like exposed to. Like,
Yeah.
for example, a child that's exposed to the death of a loved one may experience grief over their developmental period, and grief can be experienced in many different ways. It's different for everyone, which is why trauma is not general for how it's experienced and how it's coped with.
Yeah. So it's not just the event, basically, it's also how we experience it. You mentioned about having someone who's died at a young age. Also, that's almost like an early experience of loss. It's going to be different of another child who's lost a parent around their teenagehood or in their adulthood. So the impact of that traumatic event, if it happens in 3 different points of time, is going to be different. Yes.
Yeah, that's what I want to say. It's related to age, I think. First, second, awareness level of the child.
So age
Awareness
and awareness.
level of the child.
Yes. So can you tell me more? What do you mean by awareness level of the child?
I think that's related to soul. Some child that have a very wide, smart brain. Maybe they have a lot of social life. That's why they develop a very wide brain capacity.
Yeah.
Social life can affect the child.
Definitely, that connection with others and having that sense of community as
Yes.
well. It is one of the protective factors.
That will be less
Yes.
the trauma effect.
Definitely. And also the first one you mentioned was
The age.
The age. So it's the same point exactly, that it's different around the same traumatic event happening at different stage of life. We react to it differently, and the impact can be different as well. Yeah. Most children are resilient. Do we agree with that? Do we know what resilience is? Resilience بالعربي المرونة أو our ability to cope with stressful situations. Yeah, so resilience, some adults are not really resilient. Most adults are having difficulty with being resilient. Children are actually more resilient than adults. They're still learning, and by default they know that they're still learning, and there is a lot that they do not know. While as we grow older, we assume that we know much and we know everything. Yeah. Yeah, that's a very significant. Yeah. Yeah. What do you think is different between the current generation and our generation or the previous ones?
More market
they have like very they understand better, maybe, or they know more about life. I don't know.
Yeah,
what
they
is
have
the reason.
access to knowledge
Yeah,
almost
they
like
have,
it's really
yeah,
easy
you
to
are
look
right.
things
They have
up.
access to knowledge,
Yeah.
easy things to get. They like for example, they have information all the time. Like when the TV is open, when everything, iPads, everything. So a lot of information they have access to comparing to the previous generation.
Yes, and you think that's good or bad?
Depends.
Yeah.
It makes them less resilient, but on the other hand, it makes them more open for knowledge. They are more knowledgeable.
How is it that having access to information could make us less resilient, in your opinion?
Because they know more.
Yeah, so having that
To
information,
convince them, it's taking more time.
harder to convince them. They almost like know more than us sometimes, the parents. That's right. So by default, children are resilient because their brains are still being developed. So structurally, they're still forming their brains. Synapses are still being formed between neurons. So there is that capacity. If something that broke off, we can actually repair it. Our body heals differently when we are younger than when we are in our 50s and 60s and 70s. And it's the same thing with traumatic emotional experiences. Our bodies can heal a little bit more when we are younger. But also, I really think resilience is something really important for us to learn and teach. And I'm going to speak about it later on. Bharat, you wanted to say something?
Do you think resilience is a muscle that can be developed or enhanced from an early
Definitely.
age?
Definitely. And at an early age and at any age, actually. So resilience is a skill. It is a muscle. So people can grow non-athletic during their childhood and then they develop a sport. They develop interest in a sport and then they develop that muscle. They might not be as good at it as the ones who've trained since childhood, but they can still develop it and they can become really good at it. So this is something that they can develop. And we're going to talk more about it later. So their action depends on multiple things: their developmental level, their age, how were they functioning previously? Because we're talking about how kids are almost born with different temperaments, we call it, or different personalities. Yes. So one kid is easy to warm up and very social. Some kids are really slow to warm up and have a hard time adapting to their environments. And that's their pre-morbid personality and functioning. Were they doing well at school? Were they having that good connection or not? And then that trauma happens. Or originally they were having a lot of difficulties at school and then the trauma happens. That makes a big difference. Previous life experiences. So if he had a previous traumatic event and then another traumatic event, the reaction would be different from someone whose first traumatic event happens later in life. Nature of the trauma, level of severity, the exposure, how the parents react to it. We always tell parents, I see doctors and procedures telling the mom, you have to be strong around your child, don't cry in front of him, because actually it makes a difference. We sort of learn how to react to different stimuli or events by observing how other people react. So the first time the kid gets an injection, doesn't know that it hurts, but if the mom is really anxious and uptight about it, he's gonna know that it's something dangerous because it's gonna happen to me, and he's gonna be having that heightened emotion even before experiencing the event. And subsequent changes in living situation, because trauma, and depending on the type, sometimes it can have consequences on where they live. Did they have to move houses? Did they have to move countries because of that trauma? Schools, because of that major abuse that happens in his school. So the sequence of trauma also can have an impact on how much we react to it. So according to our age, we react differently. In age 0 to 2 years of age, they can have regression in their verbal skills. So they were talking and then they stopped talking, or they are not progressing enough in their language development. They can have memory problems. They keep being forgetful. They scream or cry excessively. They call them fussy or whiny babies. They have poor appetite, they can't gain much weight, and they present to a pediatrician with failure to thrive or difficulty gaining weight. As they grow older, if they experience trauma, they can have difficulties focusing, learning in school, and they can come up with us being assessed with in our clinic for ADHD or attention deficit. Develop learning disabilities, poor skills development, acting out, behavioral tantrums, imitate the abusive or traumatic event. And this is one of the criteria for us to assess also if someone has had a major traumatic event. We assess their play. So because in adults, we can have re-experiencing and we can say that this has happened to me and I'm reliving it again. But with kids, it can often happen with play. How they're playing is they're really aggressive with how they play with their toys or with their drawings, and how do they express what happened to them in that drawing, and they can re-experience it again. They become verbally abusive. They're misbehaving, basically, according to us in lay terms. They have difficulty trusting others. They can blame themselves for the traumatic event, even if it had nothing to do with them, but it's very common that shame and blame that happens. Lack of self-confidence, experiencing stomach ache and headaches. I've had a child who's 4 and was referred to us for recurrent abdominal pain. The only traumatic event she had was a divorce of her parents and the father suddenly disappearing out of the picture. And since then, she's had abdominal pain. She's been thoroughly investigated, a lot of doctors, a lot of investigation, and there was nothing. It's just that tummy pain. They can experience it in so many different ways. So for us, for a child experiencing trauma, again, so it's about difficulty expressing emotions. They're different from adults in terms of we already have that language to express our emotion, the ability to realize how that emotion feels like, that disappointment, that anger. But for younger kids, it's harder to identify those emotions and then actually express them in the right language. So this is a really key part, even during therapy, identifying that emotions. It's very common that they have low mood, they become easily overwhelmed, frustrated. They have anger, low frustration tolerance, reacting to reminders. And this is a key feature as well, especially with major traumatic events. So they try to avoid anything that reminds them of the event, including, for example, the street that accident has happened. It suddenly triggers reminders and they try to avoid it or react or throw tantrums or become really irritable around that area. Many children, on the other hand, learn to tune out or become emotionally blunt. So instead of us becoming agitated, irritable, and acting out, they actually really suppress their emotions and end up just so chill, maybe appearing as if they're not interested or dissociated or completely disconnected with their environment. And sometimes they can have explosive outbursts or responses. On our interpersonal relationships, for someone who's had difficulty, if you remember that Maslow hierarchy of needs, if we don't have that sense of safety and we've had that major traumatic event, and especially if it happens within a home environment or abused by a parent figure or someone within the vicinity of our home or a close family relative, it's going to be really hard for us to trust our parents again, or trust that I can have that back and forth reaction with this person who's taking care of me. And thus, it's going to be really hard for us to form that attachment and the relationship that comes after. And if we don't have that relationship or attachment with a parent figure, it's going to be very hard for us to develop relationship with others as well. Because the basic need for us, if you remember also again the Maslow's hierarchy, if we don't have that basic attachment, having that safe interaction, eventually we're going to have difficulty also forming friendships, intimate relationships, and so on and so forth. So they can become the anger outbursts or that impulsive or explosive reactions can cause a lot of trouble in the relationship. So a simple joke by someone that can be well received by someone, with someone who's been through a traumatic event can overreact to it. They're more likely to perceive situations as dangerous or stressful. Exams can seem like they're a major traumatic event that they have to live. And I talk about personal experience. Exams are really horrible for us. And it seems like something related also to how we have had probably traumatic experiences in our past and how we perceive other additional stressors. Something simple like us presenting in front of you today can be something extremely traumatic or extremely stressful, or can appear in my mind as something really dangerous if I've had a lot of traumatic events. While for someone else, it wouldn't. So they can react inappropriately to situations, they have difficulty forming friendships, and they have different difficulties with authority figures. So with police, with teachers, they're very defiant, they don't like rules, they like breaking rules, they run away from school, they run away from their home, and then they come to us and they get labels with something like oppositional defiant disorder or conduct disorder, but essentially, it's his reaction to trauma. So a lot of kids that present to us that can have major psychiatric illnesses, actually, they don't really have major psychiatric illnesses. It's just their reaction to previous trauma that they went through. Behavior, explosions, that intense reaction, difficulties with self-regulation. Self-regulation is our ability to calm ourselves down. And this is something that we learn during our early childhood. Kids, when they don't get the toy that they want or the candy that they want, they throw themselves at the floor and they have that very bad tantrum. And then as they grow older, they learn how to self-regulate and how to calm their body down. And mostly it's by us modeling that to them, ideally, or showing them that we can also be content, grounded, and calm around that and just accept their emotions. They learn that it's okay for me if I don't get what I want. And this is how they learn self-regulation. But if they are exposed to a major abruption or like that disruption in the organization and they've lost that connection with the attachment figure, and on top of that, I get that at a big trauma, I will have a major difficulty regulating my emotions. So whenever I feel stress, I react to it in a maladaptive way or in an unhealthy way. And that's why we see a lot of kids who self-harm. And self-harm is just their way of coping. And it's extremely common nowadays. And it's just the way they are coping to having that a lot of emotions, being overwhelmed and having a hard time calming themselves down. So instead, they resort to things that are more stressful or can be really traumatic to their body, so that this is the only way they know. Lack of impulse control. Go ahead. Yes.
Management, behavior, make the child calm down. Maybe from exercise, we need the energy, the emotion.
So yes, there is. Is it good for them? I would say no. Because if I am, for example, distraction is one way. If my child is throwing a tantrum because he wants that toy in the store, and then I'm walking down the mall and tell them, look, see that clown over there, just trying to distract them, I'm basically denying them that experience of them experiencing that frustration and being okay with it, and then learning every time, how to calm themselves down. It's more distressful for the parents and for the bystanders in the mall. Yes, but
Teaching the child, a lot of child, not just one.
yes. So you're talking a school environment.
Good behavior.
That's why there is a lot of ways a lot of things that can be implemented in the schools or in the classroom setting. One of them that is really nice is the calm corner. Previously, naughty chair. I'm completely against naughty chair, but the calm corner is basically providing them for that safe place that can engage them with different activities and they can process what happened to them and giving them that space. It can be disruptive for the rest of the class if he continues to be shouting, screaming, throwing themselves at the floor. But at the same time, this is what they are there for. It's not just learning their books and learning the math. It's also learning those skills, how to cope with that challenging situation. And usually when we've got teachers who've had children with challenging behaviors at class, it usually takes 2 or 3 times. And very tricky or very complicated situations can take a bit longer, but eventually they calm down and then they learn that, okay, next time I'll go by myself to that calm corner to help myself regulate. And this is because most of our kids, they spend a lot of time at school, not just at home. So it's really important to have those strategies also at school. Distraction is a quick fix, but it's not a good one, because it can be easier for the parent or the teacher or the surrounding. Less noise, less people looking at us, but it's not helpful for the child. It's always really important for us to experience that frustration and learn to self-regulate. And I move on to lack of impulse control. Impulse control is our ability to understand, to problem solve, or understand that this situation is having these consequences, so what should I do? Ability to have that split of a second of reflecting on that if I do this action, these are the possible sequences, and if I do the other action, there will be other sequences. So lack of impulse control is really common with kids that have experienced trauma in the past. Oppositional behavior, having difficulties with the authority figures, violence, aggression outbursts, high-risk behaviors like self-harm, smoking, excessive risk-taking, going to steal, run away from home, driving at high speeds for older teenagers, and so on. Dissociation is the one we spoke about previously, where they disconnect or become emotionally blunt. So people, in their behavior, they can have different reactions to trauma. In terms of thinking and learning, our thoughts and cognitive abilities can be really impacted. Trauma can cause us having really difficulty problem solving, attention, ability to plan in the future, forgetfulness, because if I'm not paying good attention and I'm easily distracted by if I had a traumatic experience, I perceive everything as stressful in life. So I become hypervigilant, just anticipating things in my environment that can be really stressful. So that will make it really hard for me to pay attention to what's being taught at class. If I'm not paying attention, I can't retain the information that I learned. So they come a lot with learning difficulties, being forgetful, and a lot of them, they come to us with an assessment for attention difficulties and ADHD. It's very common that the parents would come in, yeah?
Mentioning seems like with the trauma, child having trauma, child diagnosed with autism, it's very related and very similar.
Autism or ADHD?
Autism.
Trauma
Because you
and
mentioned
autism.
ADHD, so for the autism, I feel like trauma and autism is the same for younger children. It's the same symptoms. So is there like a relation between autism and trauma
So
under age of 4, let's say?
I would say one of the things that can be in common is our understanding of the world is different. But for autism, it's a bit different from trauma because it's how their brains are formed. That's why now they're leaning more towards us calling them more neurodivergent. So our neurons and our synapses are formed differently. I feel things differently. So maybe I am annoyed by noise. Yes. I'm sensitive to sounds. I'm sensitive to touch. I'm sensitive to certain textures. I like routine. I have difficulty understanding relationships, but it's not out of mistrust, not out of that abruption to a normal experience that I had or attachment with a parent or that caregiver. So I wouldn't say that it's related. I would say trauma is more related to ADHD because it can cause a lot of difficulties with attention, concentration, and learning. And with a child who's been assessed for ADHD, it's really important for us to assess for trauma, because if they've had a traumatic experience that has led them to have these symptoms, I can't really diagnose them with ADHD and give him that pill to help him with attention. I would have to address the main cause, because even if I give him a pill that will help with attention, still he will have difficulties with behavior, impulse control, self-regulation will still remain. So I cannot say that a child is having ADHD because he's having difficulties with attention and concentration and learning because of a traumatic experience that he had been through.
Trauma cannot cause autism for kids. It's like
No. No, there is no research that supports that. And actually, autism as in causes-wise, there isn't really a major identified cause yet. There are lots of genes that are linked with it and then associated, but there isn't exactly one gene that is causing it. At some point, there were talks about refrigerator mom or mom being neglectful or not interacting causing autism, but later research declined that as well. So having that severe neglect can cause us having difficulty forming relationships and friendships, but that is just one part of autism, does not qualify for a full diagnosis of autism. Psychological impact. PTSD, we hear about it a lot in movies, in series, and people who are coming back from military service, and it's more common in girls than boys. So 3 to 15% of girls who've had experienced trauma, they can develop PTSD or post-traumatic stress disorder. And the main thing is that the main symptoms of PTSD is that they keep re-experiencing it. They keep reliving the trauma as if it's happening right now. And it can happen through imagination, it can happen through flashbacks, it can happen through nightmares, and with younger kids, traumatic play. Negative cognitions and mood, they have a negative views of the world, their mood is really low. They are hypervigilant. They get started really easily. If someone opens the door, they perceive their surrounding as extremely a threat-filled space. Avoidance of triggers that reminds them of the traumatic event. And these must cause an impact or dysfunction in their daily activities. So if they have all these symptoms, but they're functioning really well, they're doing well at school and at home and with their relationship, we can say that they have PTSD. These symptoms must be causing significant distress or significant impairment in their life, whether academically and they start declining with their scores at school, or with their social interaction and they start making trouble with their friends and losing their friends, and so on. So, yeah. High arousal and reactivity, basically us perceiving anything. For example, if I hear a door opening, I suddenly startle. So me being hypervigilant, if there is any stimulus around me, whether sensory or something happening around me, I perceive it in very high, I react to it very severely. I'm hypervigilant. Any other questions? Yeah, good. On our health. So when we get any stressful experience, even as adults, we do know that some people start eating more, some people start eating less, some people start going to the bathroom more often, and that's our autonomic nervous system, the fight or flight. Our body's adapting to a very severe stress, like a danger, as if there is a lion in front of me and I prepare to run. So my heart starts racing really fast, my guts are runny, I am sweaty, I am very hypervigilant, and my eyes are really wide open, and that's a normal stress response. But if that happens repeatedly over and over again, it can cause major effects on our health. And actually, one of the really biggest studies, so studies in medical field usually would happen like 100 participants, 200, 800, thousands. But this one is one of the largest studies, the 17,000 participants. They've done it for adults 19 to 90 years old. They've done a questionnaire that is around their adverse childhood experiences, traumatic events, in other words, that they've been through their life. And then they correlated it with how their health has become and how early did they die, and they followed them for some time. So almost 2/3 of them, so 2 out of 3 had at least one exposure to a traumatic event or an adverse childhood experience. And more than 1 in 5 had actually more than 3. Of course, this is a US statistics, but again, it's almost similar because the large sample makes us possible to replicate the same results here. So for us, this can be also really similar numbers that we have. And the key thing that was really alarming in the studies, or they call the ACEs studies, is that they found that it caused this. So for kids who have had traumatic experiences, it can lead to early death in adulthood. So the physical impact of trauma during our childhood is not just only on our childhood, our behavior, our emotion, our relationship. It also impacts their physical health in adulthood. And it's the more they have experiences, the more almost amplified the results. So disease, disability, social difficulties, and early death. And mostly they studied alcoholism, depression. This is actually another study, and they studied these four main things. And in this graph, it's mainly about heart disease. And the more they had adverse experiences, the more likely they had heart disease as they grow up. So the experiences that the child goes through during their childhood not only impacts them now, even as they grow older. So what do we do? So trauma can be
I have
really...
a question.
Yeah, go ahead.
Is the questionnaire of the ACE study available online or on request?
The ACE study, a full ACE study, is not actually available. You have to purchase it, but they have a questionnaire, the ACEs questionnaire. It's a very easy tool that can be filled, and it has a scoring system, so you can access it. Yes, ACE study, yes. You can get it, yeah. What do we do? So the main idea is being trauma informed. So when we are facing any child with history of trauma, regardless of the type of the trauma, we have to have a practice. And it's not just in our physician as a practitioner, also in the GP or the primary healthcare physician, even when they go to a dentist, even if they go to, yes. Yes, we have a dentist here. Yes, it can be really traumatic how they perceive also that event happening to them. The injection, the drilling, if they had to be tied down. Yeah. So it can be a traumatic experience. So it's something that we can apply the principles here in any setting, at home, at school, or at a medical setup. So early intervention is the key word, because the earlier we intervene, the more likely we're successful. And later intervention can be helpful, but not as successful as if we intervene early in the trauma. There are individual interventions with children, with adolescents or young adults, and there are ones with working with both the children and their parents, or as a family, including even the siblings as well. The initial goals are providing a safe environment. So if the child is being abused at home and we are trying to provide therapy, it wouldn't work if the trauma is actually happening over and over again. So providing a safe environment is the number one. Support, reassurance, once safety is maintained. Attending to urgent medical needs if there was any physical harm to them. This is the initial and immediate goals of any intervention. And then comes psychological interventions. And they are focused on gaining a sense of safety again. So safety is the key. If you remember that hierarchy of needs. So if we have our basic needs met, we're fed, we slept, we are getting physically active, and we don't feel safe, we can't progress further. So establishing that base of safety would help us form that better relationship. And that's the main focus of therapy. And then as therapy goes on and as the safety is established, then the child will be able to express more emotional difficulties, behavioral difficulties, and they might not be evident in the beginning and then start forming up. So psychotherapy, and it has different modalities. The main one that we use is cognitive behavioral therapy. It focuses on how we use a pyramid of thoughts and our behaviors and how we and emotions. So if we work on each of that pillar of that pyramid or that corner of the pyramid, whether it was thoughts, it can help how we behave according to situation. If we if we work on emotions, it can help us behave better and perceive our thoughts better or perceive the situation better. So it targets the emotions, the behavior, and how we feel around it. And they've developed more trauma-focused CBT, and it's the most studied and evidence-based psychotherapy for children with trauma or adults even with trauma. Dialectical behavioral therapy is one that works mostly with people who have self-regulation difficulties. For ones who are self-harming or resorting to are very impulsive, or they resort to smoking, this is where they work on having that sense of groundedness, being more mindful, learning how to self-regulate, calm down, process our emotions, and react in better ways, our problem solve better. Play therapy with younger kids. So play therapy can seem simple, but it's actually a lot of work, and it is really effective with younger kids. in a service, it has to be the main pillars is that I'll skip this. We have to have that sense of safety. I'm going to say safety again and again and again. That trustworthiness and transparency. So a lot of parents tend to hide things from their kids, thinking that they're going to protect them. But actually being transparent can help regain that trust back. Because when a very traumatic event happens to a child, and for any child, they would expect that the main protector is their parents. And when a trauma happens to me, there would be some sort of a breach of trust with that parent who's supposed to protect me. And if that parent keeps hiding things, it's going to be really hard for us to gain that trust back. So transparency is really important. Peer support, especially for adolescents. And there are a lot of groups where their support not necessarily comes from a therapist or from a parent. Especially for adolescents, the better support would come from good friends. Yes. Yeah. Collaboration and mutuality. So basically us working together, not me giving you advice and you following that. It's us working out together and deciding together what's the best sort of action. Empowerment, voice, and choice. A lot of kids, especially ones that are disconnected, they have a really hard time reaching or finding their voice again and expressing that this is something harmful or this is a big no for me. And a lot of work on trauma is focusing back and to giving them that power back. It's really important that we keep in mind our cultural issues. For example, and we were discussing earlier how kids now are more sensitive or less resilient to stressful situations. And one of the things what we were speaking about is that previously a parent would slap their child and starts laughing. While now, if that happens, that can be a really major traumatic event for a child, or throwing a slipper at them, or having that really tough joke with a child. But now, in the current culture, it's not something acceptable to have that hurtful word or throw that slipper at us, while historically this might have been acceptable or even funny at some point. And gender issues. So managing trauma with boys can be a bit different with girls. So adapting that to our situation. Prevention. A lot of work is being around prevention, and the main thing is that study with ACEs and how much they found that the impact on adults and how much it costs the country of their physical impact and cause of healthcare. So they started working on things that strengthen families. So if we want to protect a child, we want to make them more resilient. And one of the things that can make them stronger is promoting better social norms, having more talks about bullying and how to prevent that, helping kids learn more skills, teaching healthy relationship skills, connecting them with activities, connect them with healthier adults, intervening early on. So the main and key thing that can help any child a cornerstone for any child to develop the ability to overcome a trauma, or in case, because trauma can happen to anyone. We just said that it can happen in 1/4 of our kids. It can happen within our home, and it can be out of our protection at school or in the bus or in the mall. So we can't really protect them from trauma happening to them, but we can teach them skills. And before we teach them skills, we actually have to form that relationship and that connection. And the main thing, as we grow old, as we are growing up during the first 2 years of life, is that serve and return. I'm hungry, give me food. I want to cry, cuddle. That serve and return is really important, and it's important for the kid to understand that this is something reliable and that I can count on him, even with that hug when I want to be hugged, fed when I'm hungry, I'll go to bed when I'm sleepy, and that is happening repeatedly over and over again. So that's as a younger age. It can help decrease any stress activation in case of any traumatic event, especially in the early years. adults also have to have that sort of relationship. So, for example, it's harder for a single parent that doesn't have a better support. If she goes through a stressful situation with a child, she might have a hard time managing her own emotions. While if that adult has a parent, whether it was a mom or a dad, has that strong connection, social support, it's going to be easier for her to regulate her own emotion and thus help the child. Core life skills. Adults, it starts with us, parents, and other adults in the community. It doesn't have to be a parent, can be an aunt, can be a grandma, can be a school teacher, can be a cousin who's an adult, meeting setting up and meeting goals and being that steady, trustworthy serve and return, managing their own behaviors and emotions so that we can model better, establishing daily routines, because in having that predictability is really soothing for us as we grow older, as we are, and during our early years. Facilitating social emotional development, skill building. This is not something that we were taught as kids. And it's something that we can learn from our parents as we watch them react with other people, with guests, with situations in the mall, or things happening with us in the school. But it can be actually taught. And maintaining wellness, I really like this wellness wheel, because this is not just for kids, also for us. For us to maintain our healthy well-being, we really have to have that whole circle, being physical and active, having that emotional regulation techniques, and being able to ground ourselves. Sure. Welcome.
Serve and return and self-regulating relationship.
So serve and return usually happens in the really early years. So when they want specific need like attention, we give that sort of attention. So even in the mall and they're throwing a tantrum, one of their needs is actually giving them that attention. There are different schools, and I don't want to complicate your life, but there are some schools that would say that completely ignore that behavior, but actually just making that connection is what telling them that I'm here. It's not okay for you to throw yourself on the ground or hit or throw that tantrum, but I am here and I'm going to stay here until you feel better. Okay, so this is us just allowing them to have that time to self-regulate and learn how to self-regulate, and also showing them that we are well-regulated and contained and calm and grounded, and also letting them know that we are giving them that attention. On the other hand, if we tell them, you're going to the naughty corner, you're going to go there, go to your room, I don't want to see you, don't talk to me for the next 1 hour, that sort of counteracts us providing them with that need for attention, because it is a need, just like the need for love, need for sleep, for food, that attention, it is a need. Does that answer your question? Okay. All right, so going back to the wellness wheel, having a skill is really important. Having that talent and developing a hobby can be really protective. So not just something physical, it can be something like chess or a specific game, but it's having that bits of each and every one of them and not just focus on one. For example, someone who is really good at sports, but really poor with relationships with other kids, having difficulty regulating his emotions, having issues with learning at school, making goals. It can be really not helpful that I'm having that skill at sports. It's having that whole wheel. So building resilience. For a child to look resilient, it looks like a child being able to stand up after they fall without having that major tantrum, or having some cry and telling mama I had a boo-boo, and then crying a little bit and then going, okay, and I'll be fine. So how do they respond to minimal distress, and how they can actually have a fall, or for example, fail a test or have a fall out with one of their friends and still pick up later on, even if they had that dip for a short period of time. So if you remember that homeostasis that we were talking about, so this is what happens in people who are with extreme stress, plus they don't have that skills to regulate, to problem solve, to understand consequences and plan their actions. While what we want to work out is someone that is more balanced, So regardless of the stress that's happening on each side, that we are able to maintain our balance by the skills that we've learned, by having that relationship and close connection with a parent or a caregiver, by having that skill and being able to say that it's okay if I'm not good at math, I'm good at sports, or it's okay if I'm not good at sports, I'm good at reading or whatever, having that ability to realize our own potential. So different things that can be applied, and it starts from the community and then the school and then the family. Feeling safe, having that overall positive sense of self-worth. And it's really important to find that skill or an area that a child is good at so that he can have that, start forming that self-worth, or that it's okay if I am having that stressful situation at school, but I am really good with making friends. I'm really social. I'm not really good with studying, but I know what I'm worthy of. And this is my self-worth, for example. And they start forming that values that they are good at something at least. And that also is, again, at self-efficacy and having that ability to be successful in at least one area. So I always ask parents to keep trying with different hobbies because it's really important for a child to feel good at something. Regardless if it was as simple as making bracelets. I'm really good at making bracelets. That this is something that's going to make them really feel good about themselves. Having a sense of meaning in life. And that comes from our culture, from our spiritual beliefs, from our connections to others, having goals, dreams about our future, talents, skills, we spoke about that. And having a variety of skills. So coping skills can be different. And this is something that they also learn in therapy. We learn from our parents. Coping skills can be healthy and can be unhealthy. So we try to have that toolbox, sort of more coping skills. So breathing techniques, going for our walks, listening to music, and finding my own toolbox of things that I can use to cope whenever I have a stressful situation. And again, it's a community, so it's not just one thing that can help our kids become resilient. It has to be almost an effort, not just at home, at the center, with that main caregiver. It can be at the aunt that is being the main attachment figure, or the grandma, or it can be at the school, or in the community at large. So in summary, it is common, it's not uncommon. It can have a major impact, not just on our emotional well-being, thinking processes, and our health as adults. We can prevent it. So we can't prevent traumas from actually happening to us, but we can strengthen our coping skills and our resilience so that we can face traumatic events with better abilities to cope. And the key thing is always early intervention. Thank you for listening. Any questions? You're welcome. Thank you. So I do know Baharat has a lot of questions, and there was one question that I said that I'll answer later on, and I'm not sure if I answered. And I think it was around the interventions, right? Yes. So do you remember your question? Because I didn't write it down.
It was something pertaining to road accidents, if you are in it or if you witness it.
So again, it's not just one thing that you do. It's having that full box. So ideally, it's a muscle that I'm building up already. I'm already learning to be grounded. I'm already practicing mindfulness exercises, more spiritual. I'm already learning how to cope with other stressful situations so that when or if I get faced by such a traumatic event, I can cope with it easier. And again, back to our connections with our community, with our friends, our support network. So it's a collection of things.
You also mentioned about a very important aspect, use of devices.
Use the devices, yes.
As to how distracting it can be, especially when communicating with children or even in small group settings. So in that case, as a, let's say, late teen or a early adult, how do you express yourself in a way that communicates to that person assertively that I have a problem with you using devices or getting distracted? Can I have your full attention?
I think it starts with us as parents, because if I'm using devices really often during our family gatherings, I can't really expect our kids to do anything otherwise, anything else. They're gonna do the same. So it starts with us being actually okay with having that interaction. And then I think with teenagers, it's more about having a shared activity more than just sitting and talking to each other. With younger kids, it can work more that let's talk about what happened today, what we're gonna do tomorrow, or let's do a small activity together. But with young adults and teenagers, it's about talking about them and what they want and what is interesting to them, and also finding possibly that shared activity. And most likely it's us driving them to what they want to do. But it is a normal developmental experience where they think that they know best and they know that nothing wrong can happen to them and they're invincible physically and emotionally. And this is part of their brain being developed. But I do believe it starts with us having that routine and structure in our home, having that set of home rules. Like, for example, after 10 o'clock, 10 p.m., there is no devices at home, setting that time limit. There is a lot of measures that we can set up that time limit. And I do agree it is really important. It's a good question. Thank you, Barat. Any other questions? Okay, thank you. Go ahead.
It's related to that that most of the kids now, they have access to many resources, to information.
Yes.
And sometimes they, even themselves, they abuse the information and manipulate their parents, their relatives, their teachers.
Yeah.
And so how can you as a parent to find that red thin line, you know, to understand and to try to find your way to figure out, is it something manipulative or it's real? This is the first one.
Okay.
The second one is with regards to the self-esteem of your kids. Now, sometimes in your journey to build his self-esteem, maybe you reach a wrong place where you give him more feeling that he doesn't care anymore, you know, like, this is how I want to look. I don't care. I have my confidence. I have my self-esteem and all of that. So how can also you interfere again as a parent in that and just measure if he's in the wrong path, he needs just some interfering? What is how you can figure it out?
Very interesting questions. So the first one, you were talking about how we can assess if they're using that information that they've accessed to social media are being used against us, or or it is genuine. I think it comes from our observation. So a lot of this, it can be, I don't believe really in word on manipulation. I always think that they are seeking a need. So if they are trying to seek attention, for example, by telling you that I am depressed or I'm extremely anxious while they're not, I think it's not about trying to validate if this emotion is true or not, or what happens is true or not, rather than validating their own need for attention or care. So trying to dig deep as to where is this coming from. But in terms of using information that is false, or this will need a lie detector. We don't have lie detectors. But again, observing. So I do believe that a child who is having a really major fallout, so mental, emotional, or physical, will have that just separate. It will always have other signs and symptoms. And it's just keeping an eye on everything else, not just that one thing. So trying to identify if this is within a context and understanding where it's coming from. It's always important that we validate their emotions, because even if they're expressing anxiety when they're not, it's really important for them to know that we trust them and we trust that they're saying this. So you're saying you're anxious, you are anxious. I believe that you are anxious if you're saying you're anxious, but I also try to assess for other things. So that's the first one. The second one, you were asking about how we set limits, basically. And it's something that it's a muscle for us as parents. It's really hard for us to develop. For kids, it's really hard for us to set limits, and it takes practice. And the same thing with young adults and with adolescents. But I do believe that, and actually most research says that having that limit is really healthy for them. So setting really major boundaries or really far limits that can give them more space might seem like we're empowering them, but actually it creates more chaos there. So it's not really helpful. And having that structure, that clear consequences, that clear limits, that this is the maximum where you can go, is not a bad idea. You're welcome. Thank you so much, everyone. Thank you for the ones who stayed. It was really nice having that discussion, and it was a very nice and very lovely audience. I appreciate all your input. Thank you.